Insomnia is a prevalent sleep disorder. Individuals with insomnia experience difficulty initiating sleep. They may also encounter frequent nocturnal awakenings. Alternatively, they might experience early morning awakenings with an inability to resume sleep. The manifestations of insomnia extend beyond mere fatigue. Those afflicted may exhibit pronounced daytime somnolence. Cognitive impairments, such as difficulty concentrating, are common. Affected individuals may also display irritability or mood disturbances. These symptoms can significantly impair occupational or academic performance. Insomnia can have profound implications for mental health. It can exacerbate pre-existing medical conditions. There's an elevated risk of developing comorbid psychiatric disorders, such as depression or anxiety. It is crucial to recognize that occasional poor sleep does not constitute insomnia. Such instances are not indicative of chronic insomnia. Chronic insomnia is characterized by persistent sleep disturbances. These disturbances must occur for a duration of several weeks or months. Additionally, they must significantly interfere with daily functioning. Insomnia affects millions globally. Approximately 1/3 of adults report experiencing sleep disturbances. However, epidemiological data indicate a higher prevalence in females. It is also more prevalent among the elderly population. Individuals with comorbid medical conditions are at an elevated risk for insomnia. Impact of insomnia: cognitive functions such as concentration and productivity are often impaired. Insomnia can also strain interpersonal relationships. Affected individuals may exhibit irritability and a propensity for short-temperedness. Insomnia also poses significant safety risks. Sleep deprivation increases the likelihood of accidents, including vehicular collisions, occupational hazards, or domestic falls. Human physiology is inherently programmed to adhere to a natural sleep-wake cycle. This endogenous cycle is referred to as the circadian rhythm. The circadian rhythm is regulated by the suprachiasmatic nucleus (SCN) within the hypothalamus. The SCN receives photic input from retinal ganglion cells, which convey information about ambient light levels. The circadian rhythm exerts influence over numerous physiological processes. These processes include the sleep-wake cycle, endocrine function, and thermoregulation. During sleep, the body engages in critical reparative and regenerative activities. Neurotransmitters, the brain's chemical messengers, play a pivotal role in this process. They are integral to the modulation of the sleep-wake cycle. A key neurotransmitter in this context is melatonin. Melatonin, often termed the sleep hormone, orchestrates the regulation of sleep and wakefulness. It facilitates the synchronization of the sleep-wake cycle. Endogenous melatonin synthesis is upregulated in response to darkness. This promotes the onset of sleep. Another significant neurotransmitter is adenosine. Adenosine accumulates in the brain during wakefulness. Elevated adenosine levels induce sleep pressure, leading to increased somnolence. This homeostatic mechanism enhances the propensity for sleep. Insomnia is seldom attributable to a singular etiology. It is frequently the result of a multifactorial interplay. These determinants can be categorized as environmental, biological, or behavioral. Environmental determinants encompass external conditions that impinge upon sleep quality. These may include auditory disturbances, photic stimuli, and ambient temperature. Psychosocial stressors are also significant contributors. Examples include occupational deadlines, academic pressures, and interpersonal conflicts. Biological determinants pertain to underlying medical pathologies that disrupt sleep. These may encompass chronic pain syndromes, restless leg syndrome, or thyroid dysfunctions. Psychiatric conditions such as anxiety disorders and major depressive disorders are also implicated. Behavioral determinants are actions or habits that negatively impact sleep, One pertinent example is suboptimal sleep hygiene. This encompasses irregular sleep-wake schedules. It also includes the use of electronic devices proximal to bedtime. The consumption of caffeine or alcohol pre-sleep can further exacerbate sleep disturbances. Cognitive behavioral therapy for insomnia, or CBT-I, is a meticulously structured intervention. It facilitates the identification and modification of maladaptive cognitions and behaviors perpetuating insomnia. The therapy educates individuals on optimizing sleep hygiene and enhancing the sleep milieu. A pivotal technique within CBT-I is sleep restriction therapy. This method entails curtailing the duration spent in bed, which may initially appear paradoxical. Nevertheless, by diminishing time in bed, one augments sleep drive and consolidates sleep. Stimulus control is another integral component. This technique involves conditioning the brain to associate the bed exclusively with sleep. It necessitates abstaining from activities such as watching television, working, or using electronic devices in bed. Cognitive restructuring is employed to identify and amend dysfunctional beliefs and attitudes regarding sleep. For instance, one might harbor the apprehension that inadequate sleep will severely impair daytime functioning. CBT-I assists in challenging and reframing these negative cognitions. It aids in substituting them with more balanced and realistic perspectives. Relaxation techniques are also integral to CBT-I, aiming to pacify the mind and body pre-sleep. These may encompass progressive muscle relaxation, diaphragmatic breathing exercises, or guided imagery. Both cognitive behavioral therapy for insomnia, CBT-I, and pharmacotherapy are efficacious interventions for insomnia. However, they diverge in their methodologies, effectiveness, and potential adverse effects. CBT-I is a brief, structured psychotherapeutic intervention. It aims to address the etiological factors of insomnia and equip individuals with sustainable strategies for improved sleep. The focus is on modifying maladaptive cognitions, behaviors, and habits. Pharmacotherapy, conversely, provides an immediate somnolent effect. While these medications can be beneficial in the short term, they do not address the underlying pathophysiology of insomnia. CBT-I is regarded as the first-line treatment for chronic insomnia. Its efficacy has been substantiated by numerous empirical studies. Conversely, pharmacotherapy may offer transient relief, but is associated with potential side effects. These may include somnolence, vertigo, and dependency. Moreover, the therapeutic effects of medication are often ephemeral. Insomnia symptoms may reemerge upon cessation of medication. A robust insomnia management protocol is meticulously tailored to the individual's unique requirements. It frequently integrates cognitive behavioral methodologies. The initial phase involves a consultation with a healthcare professional. They will perform a comprehensive assessment to elucidate any underlying medical or psychological etiologies contributing to sleep disturbances. Bear in mind, ameliorating sleep patterns necessitates time and diligence. Exercise patience and acknowledge incremental progress. With appropriate treatment and support, restful sleep can be restored.
Follow the series on Insomnia Management. California nurses. For opportunities to earn CE credits for this series, visit www.advancedpractice.io.